Imagine your body is like a big city. Inside this city, you have factories, workers, and highways. The main highway that carries fuel and oxygen is your heart and blood vessels. If that highway gets blocked or damaged, the entire city slows down. That's how serious heart and vascular diseases are. They don't just affect the heart, they affect your breathing, your energy, your movement, your whole life. So let's break it down together, step by step. The heart is like a pump, about the size of your fist. Its main job is to push blood, full of oxygen, to every single cell in your body, working non-stop 24 hours a day. The arteries are like flexible tubes carrying that oxygen-rich blood from the heart to the organs. Veins bring the blood back. Altogether, this network is called the circulatory system. Think of it like water pipes in a city. If they get blocked or break, water can't reach the houses. The same happens with blood. Now, what kind of problems can happen? One is angina, when an artery to the heart becomes narrow. You feel chest pain or pressure, especially with effort. Another is a heart attack, when the artery suddenly closes completely. Part of the heart muscle dies because it's starved of blood. There's also heart failure, when the heart becomes too weak to pump properly. People feel tired, short of breath, even with small effort. High blood pressure is another one. It's called the silent killer. It forces the heart to work harder and damages the arteries slowly. And then there's atherosclerosis, when fatty deposits build up inside the arteries, making them stiff and narrow. That's the root of most heart problems. Why do these diseases happen? Some reasons we can't change: age, gender, or family history. But many reasons are in our hands: smoking, unhealthy food full of fats and sugars, lack of exercise, obesity, high blood pressure, diabetes, and constant stress. How do we notice early signs? Sometimes it's tricky, but there are warning signals: chest pain or pressure, shortness of breath, unexplained fatigue, irregular heartbeats, dizziness, fainting, or swelling in the legs. And remember, people with diabetes may even have a heart attack without strong pain. Doctors use several tools to check the heart: ECG, ultrasound, blood tests, catheterization, or simply measuring blood pressure regularly. But the real question is, how do we lower the risk? This is where lifestyle makes a huge difference. Eat healthy, less saturated fat, more vegetables, fruits, whole grains, and fish. Drink enough water, and cut down on salt. Stay active, at least 30 minutes of brisk walking 5 days a week. If you don't like gyms, any movement helps: stairs, cycling, dancing. Quit smoking, it narrows the arteries and sticks cholesterol to the walls. Just 1 year after quitting, the risk of a heart attack drops by half. Control blood pressure and blood sugar, check regularly, follow treatment if needed. Manage weight, even losing 5 to 10% of your body weight makes the heart's job easier. And don't forget stress: sleep 7 to 8 hours, relax, breathe deeply, talk to people you trust. If disease happens, treatments are available: medications to lower blood pressure or cholesterol, blood thinners, stents, or even bypass surgery. People often ask, if I feel chest pain, should I wait and see if it goes away? The answer is no. Go to the emergency room right away, especially if it comes with sweating or nausea. Does quitting smoking even help if I've smoked for years? Yes, it really does. After 5 years, your risk becomes almost the same as someone who never smoked. What about eating heavy, fatty meals once in a while? The issue isn't one meal, it's the habit. But remember, even a single heavy meal can trigger a heart attack if your arteries are already very narrow. The takeaway: heart and vascular diseases are not destiny. 70% of the risk is under our control. The heart is like a car: if you maintain it, it lasts longer and works better. If you neglect it, it can suddenly break down. So protect your heart. Eat more greens, move your body, stay away from smoking, check your blood pressure and sugar. Do this, and you give yourself the best chance at living longer, healthier, and stronger.